Bad Breath Busters is Dr. Pia Lieb. She's a dentist here in New York City. Thanks for coming in this morning.
Thank you for having me.
We should say seriously for a second that bad breath can come from something serious, and you should really see your doctor about it, right?
Absolutely,
Like
absolutely.
infections in the mouth.
Absolutely. If you see that you have a permanent bad breath, halitosis as we call it, for more than, let's say, 4 weeks, then I would strongly recommend that you go in and you see your dentist and make sure that it's not periodontal disease, or it could be some sort of GI problem, and take it from there on.
Okay, so let's get into some of the common things here. We have, a lot of people don't think about this, peroxide, baking soda, or salt. How do these work?
It's wonderful. Basically, there's bacteria in your mouth, and you're trying to eliminate that bacteria, which basically lies on your tongue, your tissues, and in between your teeth. So by doing peroxide, it absolutely is wonderful with the salt and with the baking soda. It neutralizes the bacteria, kills the bacteria, and you can eliminate the bad breath.
So you rinse and spit, what, in the morning after you brush? A good idea?
After you brush and after you floss, of course.
Okay, great. And it's what, like a 50-50 kind of mix?
I would do a third peroxide and 2/3 water, and then put in a little salt and put in a little bit of half a teaspoon of the baking soda, and you should be fine. And you can do it in a container and keep it for 2 or 3 days. Or if you like it cool, you can do it in the refrigerator, keep it in the refrigerator, whatever you like.
All right, just don't swallow it.
Don't swallow it.
All right. Now, antacids, a lot of people don't realize antacids, you mentioned it before, but reflux can cause bad breath?
Reflux, and there's other complications. You can have ulcers and other complications that you don't know about that can cause all of this. That's why you should absolutely go to your MD and have it checked, and if it persists more than a month.
Right. So it's not just smoking, it's not just garlic. This is a serious problem.
No, this is serious. Absolutely.
Okay, parsley, your friend, if you're on a hot date and you've had garlic, how good a friend is this?
It's wonderful, especially if you're out at a restaurant and you know how they garnish it?
Right.
And there's always a garnish of, well, if you can just sneak it in and just take that at the end, it's perfect.
Yeah, you don't want your date to watch you because then she'll think,
No,
oh, this
no,
guy's
no,
weird,
no,
he's chewing parsley.
But then you'll smell wonderful because it neutralizes all the odors. It's great.
Okay, now flossing, a lot of people don't realize how important flossing is, and we've got some good stuff here. Let's talk about that.
Well, the flossing is wonderful because all the plaque that accumulates in between your teeth, you have no way of removing it with a plain toothbrush. You only clean the surface of the tooth. And interproximal, there's no way we could reach. So that's where the floss comes in, and you can have great.
Love this.
This is absolutely. This is for.
You see that vibrating? It's like a flossing hummingbird.
This is for people who do not want to go in and floss with traditional floss. This is a happy flosser because you look at it and you don't think it's dental floss, but you do it. Hopefully it motivates you in the morning and at night, especially at night, that you do it.
And all the way in the back too. Don't forget in the back of that last tooth in the mouth,
this is why I recommend this, because you could actually reach back there, right? If we can open it.
Sure.
And get in between your last 2 molars. It's so much easier to use than trying to get your fingers and
all the way back
and going all the way back.
Okay, now tongue scrapers. A lot of people don't realize this is a very, very important thing. When to do it?
Well, I generally recommend that you brush first, floss. Oh, and this has 2 textures. I'll tell you all about this. And then just rinse. And then what happens is you brush with toothpaste on the tongue.
Right.
And then you go in, you rinse your mouth out, then you go in and scrape with this. Now, this has a soft side for people who don't want to remove too much. You want to leave a little behind. Where there's a hard, well, it has a hard side, which is what I recommend. And then this is just a dual line, which also it acts as like a razor with 2 blades, but 2 blades to scrape the tongue.
Okay, now we got to wrap up. But finally, just mouthwash is just a cover-up. Really doesn't work.
Right.
And brush your teeth. Obviously, good dental habits. 2 minutes at least.
2 minutes, and this is great because this has a timer on it, and it's 2 minutes, and you know exactly what to do.
Great. Okay, Dr. Pia Lieb, thanks for coming in.
Thank you.
Jim, get any tips here? Anything you could use? Anything you want to take home? What do you think?
Heck no.
If you want, I got some stuff.
The hummingbird. Give him this.
I don't know, that tongue